Hello, my name is Matt Lippert. I'm the dairy educator for Clark and Wood counties in Wisconsin. I'll be your moderator today. This is called Badger Dairy Insights. It's a program we've been having on Tuesdays during the winter here. It's part of a larger group of programs called Farm Ready Research, winter programming for agriculture. Our topic today is raising them right, calf and heifer health. Just a few housekeeping things before we get going. We'd ask you to please mute your microphones during the presentations. It'll improve our audio quality for everyone. The mute icon can be found in the lower left hand of your screen. If you see a line through the microphone graphic, you're muted. We encourage you for asking questions today during the session. You can use the chat feature, which you can also find in the bottom middle of the screen there. You can enter your question there and we'll address them. I guess the plan today is to address them at the end of each presentation. So today's program features two speakers who will provide valuable information on preparing, for calf health and care. Our first presenter is Matt Akins. Do we have Matt's second slide so we can see his beautiful face? So Matt will present on recent UW research on heifer coccidiosis and egg-based antibody feeding. Matt is an assistant scientist and dairy extension specialist with a focus on dairy heifer nutrition and management. His projects have focused on use of alternative forages in heifer diets and evaluation of coccidiosis prevention methods. Matt has a bachelor's degree in animal science from UW-Platteville and a master's degree in animal science from the University of Arkansas and a PhD in dairy science from UW-Madison. As part of this role, he works with the Marshfield Ag Research Station to conduct heifer feeding and grazing studies. A few other people I'd like to mention before we get to Matt's talk. Tina Coleman, the dairy and livestock educator from Fond du Lac County, has contributed greatly to this program, as has Amanda Young, the dairy and livestock educator for Dodge County. On behalf of our team, I'd like to thank you again for joining us today. And with that, let's start with Matt's presentation.
All right, thanks, Matt. Appreciate everybody taking the time to take part in this this seminar. So hopefully can gain some pointers as far as calf and heifer health that you can take back to your operation or to your client's operation. So my talk will be on some of the recent UW research that we've been doing up in Marshfield on heifer coccidiosis and using a novel egg-based antibody. I just want to thank a couple of grad students that have been a big part in this this work. Abby Grisham, who's now Abby Nieber. She did a lot of this work, did thousands of fecal counts and spent a lot of time on this project. Also Sherry Nolden, she did a lot of the work as far as the antibody preparation and working with Abby to do this work. Also want to acknowledge Dan Schaefer and now deceased Mark Cook as co-investigators of planning and conducting this work. So all right, so just an overview of the talk. I just want to get over a little bit on coccidiosis management, what coccidiosis is, what symptoms, prevention and treatment strategies before we get into the actual research side of it, so you have some kind of basic understanding of it. Also, then we'll get into some of the development of these egg-based antibodies at UW and the work that Mark Cook did and how these work in the animal's digestive system. And then we'll get into actual recent research that we've been doing up in Marshfield. So before that, I just wanted to get an idea as far as just a short poll question as far as what your view of how prevalent of a problem coccidiosis is on your farm or your client's farm. So is it a very minimal problem with very few or no treatments of heifers for coccidiosis, or do you have progressively increasing prevalence on your farms? Just to get an idea of what we're dealing with and the prevalence that might be out there in the field. I'll give you another few seconds to fill this out just to. All right, so it looks like about a third of you responded with you haven't had any treatments for coccidiosis in the last year, about 40%, pretty low levels, less than 2% of heifers were treated. And then about the next third had moderate to higher levels of treatments for coccidiosis. So definitely a range of prevalence. So it's that's what I would expect, just based on experience. There's a lot of variability in this disease across farms, and especially on our farm that we work with. All right, thank you. All right, so so what is coccidiosis? It's a disease caused by a protozoa of the genus Eimeriae. It's also known as coccidia, just as a general term. And the protozoa invades the animal's intestinal lining, so it actually invades the intestinal cells and causes destruction of the intestinal cells and the lining, causing problems with absorption of nutrients. So to have this disease occur, you obviously have to have ingestion of a protozoa, the oocysts, and that can be from a number of sources, either feed, contaminated water that has fecal material in it. Grooming is a common place for this to happen when they groom each other or themselves. So lots of different sources where they could pick up these protozoa oocysts or the eggs. There are certain species of these Eimeriae that are pathogenic to cattle. So the most common ones of cattle are Eimeria bovis and Eimeria zernii, are the two most. Another species that we found in our samples are Eimeria albernicis, but it's much less prevalent and not as, doesn't seem to be as prevalent in our samples. It's most common to happen in younger animals, especially from about 1 month to 1 year of age. Typically on dairies, it's going to happen at the time of grouping. So when you have individually housed animals and you're putting them into a larger group, that's a very common time frame for that to happen. It also happens quite often during stress events, so transport, possibly dehorning, castration for bull calves. That's can cause the immune system to be slightly depressed and cause those Eimeria to cause an infection. But these animals will develop immunity over time with especially with small exposures. But with very high exposure rates, it can very quickly explode into a more clinical signs, which we'll get into. And from some recent U.S. Data and beef cattle operations, they had about 60% prevalence on about 100 operations. Another recent survey in Minnesota actually found on grazing dairies, whether they're organic or conventional, larger, small conventional farms, actually found that of those ones that they got samples from, about 100% of those samples actually contained Eimeria oocysts. So it is a very prevalent protozoa in the environment. So the species that will we're going to see mostly these, again, the Cymeria zernii and the bovis. As far as the incubation times is about 15 to 20 days. So that's why we generally don't see this in very young calves. It's going to be generally at least in calves or heifers that are 3 weeks of age or older. As far as what they look like on the microscope, you can see when we do these fecal floats tests, this is an example of a Cymeria bovis. It's more of an egg shape, and this is an Cymeria zernii. It's more of a round spherical shape. As far as the life cycle of Cymeria, it's directly related to cattle, and so the animal actually defecates the oocysts. They stay in the environment for a very significant amount of time, from several days to up to a year or longer, depending on moisture levels and temperatures. And then that animal somehow takes it back in through contaminated feed or grooming or water. So it follows that whole cycle. So that cycle has to continue for the protozoa to persist. This is a little bit more in-depth life cycle. So on the bottom in the green, we have the oocyst. The animal takes that in, ingests it. That oocyst then bursts, and then these sporozoites then infect the intestinal cells. They then asexually reproduce in those cells. They then, once they are mature, they then burst, open the intestinal cells, again, causing direct damage to the intestines. They then go through another asexual reproduction cycle further down in the small intestinal tract. And again, they go through their maturation cycle or stages. Again, burst open, and that's later stages of the small intestine. And they'll, in the large intestine, they'll then go into reproduce sexually. So then they will mate and then produce oocysts that will burst again from the large intestinal cells and then be excreted into the environment to restart the cycle. So most of the symptoms that we see as far as are going to be like the diarrhea are going to be fairly late in this stage, especially if we see bloody feces, because you're not seeing the symptoms clinically until they actually get into the large intestine. So this whole cycle from the time they ingest it until you actually see it clinically is likely going to be at least 15 to 20 days. So there's a lag time in there between actually the infection and the clinical symptoms. As far as the symptoms, they can be really variable depending upon the severity of the oocyst load that they take in. Typically, a very small percentage of them will be clinical. In some earlier work that was done, they estimated about 5% of calves and heifers will show clinical symptoms, while about 95% of them will have, in being that more earlier stages of subclinical disease. During that subclinical disease, they still have an impact. They're going to have damage to that small intestine especially. So that's going to result in decreased growth and also possibly intake due to the animals not being able to absorb their nutrients as they should be. As far as clinical symptoms or signs, often you're going to see high amount of condition loss, anorexia. They're very quickly, their digestive system is losing weight, and they become very thin. Their feces become very watery. You don't want to be standing behind one of these calves if they do have clinical signs. I can just tell you from experience that it can be a very violent watery diarrhea. Later on, once they've defecated a large amount of the material out of their digestive system, they actually have very minimal amount to defecate, so it can actually cause straining to defecate. So you often see you'll see animals like this where they'd be straining to defecate, but they don't have anything that they're actually excreting. You also generally, in a very severe cases, damage to the large intestine, you'll start to see bloody feces at that point. And if you if you don't get that treated very quickly, that can often result in death because of the animal is severely dehydrated due to electrolyte losses. As far as treatment of coccidiosis, before you would want to treat animals, you want to work with your veterinarian to diagnose what the actual infective agent is, because it could be a number of agents, whether it's E. coli, crypto. There's a number of other digestive disorders that this could be caused by. So you want to work with your vet to get a fecal float test, just to diagnose to make sure what that is. If it's confirmed that it is coccidiosis, work with your veterinarian to develop a treatment protocol. If you're not feeding a coccidiostat, I would recommend to start using one if possible. Obviously, some producers can't, if you're, say, organic, but if you can, I would start using one to help control those loads in the progress of the infection. So you kind of slow down the excretion of the oocysts and start reducing that load in the environment. Also, cleaning the pens up more regularly, removing bedding more regularly, and sanitizing it will help to control those loads as well. As far as treatment, direct treatment and petroleum is probably the most used treatment. As far as treating individuals, we always do drenching as far as in a research setting. Removing animals from the group will help that animal out as far as allowing the animal to rest and to recoup and get their intakes up again. If that's not possible, providing pellets to the group as a whole will help to also reduce the loads, because if that animal is infected, it's highly likely that the rest of the group is also highly infected as well, just maybe in a subclinical phase. So providing a pelleted amprolium can help to reduce those loads and to break that cycle. If you have animals that are in, again, clinical symptoms where they're having watery diarrhea, you want to be providing fluid therapy with those as well, in addition to the amprolium treatment, because those animals are likely severely dehydrated. So you're going to have to help those animals regain those electrolytes and the balance. Prevention is obviously the best measure for coccidiosis, and really management and cleanliness are probably the key factors with this. Providing clean, dry bedding, making sure you're adding bedding on a routine basis to keep the bedding clean. Getting that dirty bedding out of the pen on a routine basis also. So if you have a large buildup of bedding in the pen that's dirty, those coccidiosis will build up in that bedding and continually reinfect those animals. Also, make sure you clean the waterers, right? Obviously, we see animals, they don't have much control over their feces or where they defecate. So they will go in the water. So you have to be cleaning those and sanitizing those on a regular basis, as well as the feed area, making sure that that's cleaned out, or the animals are not able to defecate or in that. As far as sanitation, we want to try to keep, especially with these younger animals, we want to try to provide some break in the cycle. So using all in, all out management for these younger animals can really help break these cycles, allow you to clean those pens between groups, can really help to reduce the load. One thing to keep in mind is that very few disinfectants actually destroy the oocysts of Eimeria. Of the ones that I've looked at, I think ammonium hydroxide is one of the only ones that have really proven to destroy the oocyst. There's some other products out there that also claim to help reduce the Eimeria in the environment. But I would check your disinfectant to make sure that if you're using that in your calf and heifer area, that it is also effective against Eimeria. And coccidiostats can really also help minimize the loads in the environment and that are excreted. So, and you can use any one of these, monensin, salsa, dicoquinate, or improlium are all approved coccidiostats that can be fed and used in the feed. So the way these work, so monensin and lausalcid are considered what we call ionophores. They simply act by creating a pore in the cells, the protozoal surface, that allow it transfers mainly cations like sodium across and into the cell. What the cell then has to do is use energy to then transport that ion out of the cell to maintain its electrolyte balance in the cell. So over time, that cell uses energy to continue transporting the ions out of the cell, and it uses its energy, and then eventually the cell will run out of energy and rupture due to the increase in ions and water inside the cell. These are also very commonly used in the rumen as far as improving feed efficiency, especially over monensin and lausalcid. So they also have that effect in the rumen to increase feed efficiency. Dicoquinate acts a little bit differently. It actually enters the cell and disrupts energetic functions directly in the electron transport chain. So it directly disrupts the cells cannot produce energy using dicoquinate for the protozoa. Amprolium, I don't have it on here, but that works in a little different way. It actually mimics the vitamin thiamine. So then the protozoa take in the amprolium, and then it doesn't allow the protozoa to reproduce. And then that basically stops the reproduction of the protozoa due to the lack of thiamine. There's been a number of possible alternatives out there in the industry and they also been tested in research. These include essential oils, botanicals, plant extracts. There's been some work to show that they are effective in vitro and also in some poultry research as well. Just looking through the research on the dairy and beef side, there is some positive results in some studies, and other studies haven't found control of coccidia with these. So I think there's opportunities out there to use these, but I think there needs to be additional research to see which essential oils and botanicals really are effective to control coccidia consistently, and how we should be feeding these to animals. So I think there's opportunities, but I think there needs to be a bit more research is trying to figure out which one of these products are most effective, or which oils are most effective. So next poll question I have, just to get an idea of what everybody is using on their operations, is what preventative feed additives are you using on your farm or on your clients' farms? So either coccidiostats, essential oils, or botanical blends, or not using any. Okay. All right, so looks like we got a pretty good poll there. We got about 70% if you all responded with that, you use some kind of coccidiostat, about 11% using some kind of essential oil or botanical product, and then 6 or 21% are not using a feed additive to help control coccidia. So that'd be expected. These coccidiostats are very prevalent, but I know that there are producers looking for some alternatives. So next, we're going to get into the actual research on what we've been looking at Marshfield and in Mark Cook's lab. So Mark Cook's he had done a lot of work with poultry and coccidiosis, and what they found is that chickens that were infected with Eimeria, when they sampled their intestinal tissues, they actually found that the animals that were infected, these were the black bars, had higher levels of a molecule we call interleukin-10 in their intestines for the ones that were infected. So this is an important finding that he found. And why it's important is that interleukin-10 is an anti-inflammatory cytokine. And what a cytokine is, it's an immune system communication molecule that the immune system uses to basically tell the immune system to shut down after typically after a normal attack by pathogens. So after the body takes down the pathogen, it'll secrete interleukin-10, basically telling the immune system to shut down. You've done your job. If it did continue to attack, it might cause damage to the body cells and not just the pathogens. What's unique about the fact that interleukin-10 is present when Eimeria is that it suppresses the immune system. So if the immune system is being suppressed due to Eimeria, that just tells you that the Eimeria is causing it's telling this immune system to shut down, which is not a good thing. We don't want to be doing the immune system to be doing that, especially when it's being infected. So under a normal mucosal environment in the intestines, so if we have this is what we call the enterocyte or the intestinal cell, and this is all the bacteria and the gut. We have the immune cells. These are like the macrophages that attack the pathogens, and we have these regulatory cells that basically tell the immune cells what they should be doing. So if we have in a typical situation, we have the pathogen invade the cells, the macrophages or the immune cells then attack the pathogen, and then it's dealt with. It is eliminated. In this case, the Eimeria invades. It then somehow sends out what we call macrophage inhibitory factor. That's what Mark had called it. And that causes the regulatory cells to secrete IL-10. That'll basically tell the other immune cells to not be active and then to go away. Those pathogens then are able to replicate and then to become a full-blown infection. So basically, the Eimeria is fooling the immune system to not become active. So what Mark has thought up is, why can't we just bind the IL-10 in the gut so that the immune system can have a normal immune response? So he came up with this antibody to IL-10. And what he was looking to do is by binding IL-10 or interleukin-10, the pathogens aren't able to suppress the immune system, so that that allows the immune system to adapt and to have a normal immune response to the pathogen. So then that allows adaptive immunity over time to then respond to that infection and then clear it through a normal response, and then develop a long-term immunity to that specific pathogen, which is what typically would happen. So how do we actually create or make anti-IL-10 or this antibody to interleukin-10? We actually make it by immunizing chickens, laying hens. They immunize it to a certain portion of that peptide or the protein, the IL-10 protein. And then they collect the eggs, and then they separate the egg yolks, which is where the antibody is found. We then pasteurize it, and then it's able to be fed to the animals. They also can be dried, and then it can be added to feed mixes. And the thought process is, now this likely, in this diagram, is probably not completely correct, because the antibodies are not going to be found inside the cell. They will be on the outside of the cell out here, and that will be binding the extracellular IL-10. So this diagram is a bit off. But this is just to give you an idea of what would happen. So it sends that signal to the regulatory cell to make IL-10 and secrete it, but then the antibody binds the IL-10, and then the macrophages are able to have a normal response to destroy the pathogen, and for the adaptive immune response to build up long-term immunity. So that's the whole thought process of this antibody technology that Mark Cook had thought of. So they did some work with this in chickens. This is one of his early experiments. So they had a control treatment where they didn't have any antibody, and then they had an antibody treatment. And then they had another treatment where they they challenged the chickens with Imeria. So they dosed them with Imeria. Obviously, the chickens that were challenged with Imeria had lower weight. But when they provided the antibody, it helped somewhat, not significantly, but it did tend to help the animal improve its or reduce the amount of weight that it would have not gained if it would have not been treated with it. So this is not a significant effect, since this has the same letters B and B here, but it definitely had a numerical improvement in its growth. It also generally had a reduction in the amount of Imeria that the chickens were excreting when they were treated with the antibody. So it's having some kind of effect in the gut to help clear out that Imeria infection. There's also been work by Dan Schaefer and in beef cattle at the UW. These were newly arrived or transported feedlot steers, and they looked at 9 pens of steers, about 57 animals total. They didn't see a significant response as far as weight gain. There's a numerical response there, but not significant. Not a significant improvement in the daily gain or in intake, but when you look at the overall efficiency, or what we call gain to feed, so how much gain per unit of feed intake, the anti-IL-10 treated animals had a improved feed efficiency. Also, they tended to see a reduction in the number of multiple treatments for respiratory disease when they fed the antibody. Something's going on there with the immune system to to help improve the feed efficiency, and it's likely due to the respiratory effect. They've repeated this study, but they have not seen a similar response. So it's not been a consistent response across studies for what this lab has seen. The UW Vet School did another project with calves. Again, one of the treatments was a control. It's the green bars, and the anti-IL-10 treatment is the purple bars. So they saw a reduction in antibiotic use for the anti-IL-10 treatment and in the incidence of respiratory disease. So again, something's going on there with the interaction with the gut and the respiratory system, which is a lot. If you talk to a lot of veterinarians and scientists, they're noticing that same thing. When you have a healthier gut, you also generally have a healthier respiratory system as well. So we've seen some positive results with this use of anti-IL-10. So we wanted to look at this in heifers. So we developed a project to evaluate the use of this antibody in newly transported animals, or heifers, from Arlington, Wisconsin, up to Marshfield, which is about a 3-hour transport time. We're mainly looking at the disease incidence, growth, and feed efficiency. And again, we are looking to see if that antibody would help the heifers to develop immunity to Amiria more quickly than if we would have not treated them at all. So we've done a total of 3 projects so far, one in 2018, 2019, and we just finished one in December in 2020. I'm just going to be telling you about the results from the 2018 and partially from the 2019 study. So in the 2018 project, we had a total of 20 pens of heifers with 8 animals per pen, so 160 total animals that we put through the project, 40 animals per treatment. And the treatments included either an ionophore, which was monensin at 150 milligrams per animal per day, and that was provided either through the grower or through the mineral once they were on a TMR. And then the other treatments were the antibody to IL-10. We provided that through a liquid egg yolk that was pasteurized, which we got this from immunized chickens from the UW poultry flock on campus. We fed that for a total of 14 days after they arrived at Marshfield. Then we had an egg control because we don't know, maybe there's some antibodies or proteins in the egg that might also have some kind of effect on the animal. So we always have to do a control treatment to account for that. And then we have a negative control where they don't have any egg or any ionophore added to the diet. And then we tracked feed intake, hay, grower, and TMR throughout the project. We looked at growth, and then also looked at blood to look at immunoglobulin content, and then obviously the feces. We wanted to look at the fecal content for the coccidia loads. Just to give you an idea of the facilities at Marshfield, the top 2 pictures are from our transition barn, where they come up from Arlington. They stay in this transition barn for about 4 weeks, just to get them acclimated to the environment, get them used to the maybe different bacteria, pathogens at our facility, and then to try to get them adjusted to the higher forage diet. So they're fed a combination of grower and hay while in this facility. You can see that generally they're bedded with wood shavings and as a base, and then they put straw on top, and then continue bedding typically every day, and then clean it out every 2 weeks during this, to try to break that cycle and clean it so that we don't have as much transmittal or shedding. And then once they're about 4 months of age, they then go from this transition barn to a bedded pack barn with a feed lane. This is one of our pens here. So you can see there's a bedded pack in the back of the pen with sawdust as the bedding. And then in the front is a scrape alley so every day the bedded pack is turned, and or we use a plow to basically mix it up, and then we put either a mixture of sawdust or some straw on top of it, and then we also scrape this front alley to clean that on a daily basis. One thing to note is that, and in a lot of facilities, is that these animals are likely transmitting the disease across. So if we have younger animals here and older animals down here, when we mix that feed up or even just go down the lane, or these diseases are easily transferred in this type of facility, and a lot of our facilities. So that's just something to consider, is that it's really hard to control through in these type of buildings, in these facilities, because there's really a very difficult way to prevent transfer when you have younger animals and older animals together. So that's just something to think about. So really, clean bedding is a really important part to make sure that they have a clean place to lay down, and make sure they're keeping their coats nice and clean, so they're not getting a buildup of manure when they're grooming themselves. Also, the waters are really important to keep clean. On a routine basis, those need to be scrubbed and cleaned, because you will see them defecate inside the water, especially if you have a water inside the pen. If it's outside the pen, it might not be as much of a problem. To run the fecal analysis, we do what we call fecal floats. We put about 5 grams of feces in here with a Epsom salt solution that causes the Eimeria to then float. We mix this up. We put it in these discs. We let it sit for about 10-15 minutes. That allows the Eimeria to float to the top. We turn this to then drag the Eimeria to the counting grid. Then we count it, Eimeria, on the microscope. So going on to the results from the project. So as far as growth or average daily gain, we did not see a significant effect across the treatments when we looked at overall gain. You can see the anaphor had a numerically higher daily gain, but it's not significantly different from the rest of the treatments. But overall, they were gaining pretty well, about 2 pounds per day. So that's right where we're targeting for this size of animal. As far as feed intake, again, no difference across treatments, right around 9 to 9.5 pounds of intake per day. But when we look at the feed efficiency, the conversion, this is the pounds of dry matter per pound of gain. The anaphor was significantly better, or had lower intakes needed per pound of gain compared to the egg control, but not different from the antibody treatment or the negative control. So, but definitely had a numerically better value compared to those treatments. So that's just something to consider, that the anaphor treatment, even if it's not significant, it did have a improvement as far as efficiency. And if we look at the coccidia prevalence across the project, we don't see any week 0 values. So these animals actually, what was interesting is these animals came up to Marshfield completely clean, as far as they weren't shedding any Eimeria oocysts when they first come up. Within about 2 weeks, they start to show some shedding. So all 4 treatments were shedding oocysts by the end of by that second week. By week 4, we were getting very high prevalence of fecal floats, except for the anaphor. So anaphor, about 29% of the calves had positive coccidia counts, compared to the other treatments were at 64 to about 85% of the calves. The egg control tended to be a little lower, but I'm not sure what's going on there. But the IL-10 treatment and the negative control were similar. But by week 8, at the end of the study, all 4 treatments were similar. About 80 to 90% of the calves had positive coccidia counts. So very prevalent, even if they were being fed ionophore. And if you look at the actual concentration of the oocyst in the feces, again, very low, or zero on week at the start of the study, but by week 2, this is not the correct data here. This should be much lower. That value is incorrect. So, but they're all about 1 log concentration at week 2. By week 4, they were right around 4 logs on the log scale. And by weeks, and that's when we saw the difference, was at this week 4 again, similar to the prevalence. But by week 8, all the animals had similar concentrations of oocysts in their feces. So there's obviously, all the treatments are having some kind of even with the anaphor, they're having some oocysts in their feces, and over time, it seemed that it had a delay, but because of the high environmental load, those animals still accumulated in their system. What was interesting is that we looked at the serum IgG levels. These egg treatments, whether it was an egg control or anti-IL-10, they had an increase in IgG levels by the end of the study by week 8. And we don't know what's going on here, whether it's they're reacting to some novel protein in the egg. We don't know. That's what we're hypothesizing, is that they're having some kind of response to some novel protein in the egg, and then they have an immune response to that egg protein in their body. But we don't see any difference between the egg control and the IL-10, so that's what we're presuming it is. We see a slight increase at week 8 for ionophore, but not as high as the egg control or anti-IL-10. So just to summarize what we found in the first project, the anti-IL-10 didn't reduce the fecal oocyst prevalence or the improved growth relative to the ionophore treatment. It did have similar feed efficiency values than the ionophore, so it may have had some improvement there, but didn't really act on the oocyst prevalence. The ionophore definitely helped to prevent or delay that onset of fecal shedding, and definitely the clinical treatments were far lower than for the ionophore treatment. Was one obvious outcome that we saw. Something that can keep in mind is that the timing of the anti-IL feeding didn't really correspond to when we had Eimeria infection, which we saw the Eimeria infection starting at 2 to 4 weeks. We were feeding the antibody during the first 2 weeks, so they didn't really coincide with the infection. So we came up with another study, basically reran that whole project in 2019, but we changed when we fed the egg yolk. So instead of feeding it from the first 2 weeks of arrival, we changed it from the second to the 4th week after arrival, to try to hit the target where they had higher prevalence of Eimeria that we knew that they were infected. Very similar project, basically the same exact project, just a little different strategy as far as dosing it. Unfortunately, we didn't find any difference in the daily gains across the treatments, similar daily gains. But again, we saw similar results with the anaphor having slightly numerically higher growth than the other treatments. Again, the feed efficiency tended to be a bit higher or improved for the anaphor, which was similar to the 2018 results. And we saw very similar trends as far as the onset of this coccidiosis prevalence and concentrations as time went on in the pens. And again, we saw lower clinical digestive treatments for the anaphor. Interestingly, we saw for the egg control treatment, we saw slightly higher respiratory treatments. For the egg control, we don't really know what's going on there, but we know that respiratory disease is highly variable, so that we don't know if that's just due to chance for that treatment. Just to show you that, the data from the last study from 2019, so very similar. So week 0, they come up clean. By week 2, we start to see a slow increase in the prevalence of coccidia in these animals, especially the negative. With egg control and the IL-10, we see maybe a slight delay, but really very minimal. But by week 4, these are fairly similar at about 90% for the negative and the egg control. Anti-IL-10 might again be a slight delay in that infection, and actually similar to anaphor. But by week 6, all similar. By week 8, all 4 treatments had a similar prevalence at about 90%. And actually, they start to go down by week 10 at the end of the study. So they're starting to build up some immune response by that point to the Imerium. So just in summary, cleanliness and management are probably the most critical to really control of coccidiosis. So cleaning and management, keeping the pens sanitized, checking to make sure your disinfectants work, keeping bedding clean, and your waters and feed management. Coccidiostats are definitely useful in trying to delay the oocyst shedding and reduce the amount of clinical treatments. It also allows the animal to build up its immunity over time because you're reducing the load content for the animal. As far as anti-IL-10, I think we need to do additional work with this. As far as we did a feeding rate trial last year, and I think we'll be finishing up that data earlier this year to see if we have to feed a higher dose of that. One thing to keep in mind with this egg products is that you got the rumen to deal with. The rumen is very good at degrading proteins, so we don't know what kind of rumen degradation of these egg proteins there are. So we're also going to be looking into that and seeing how much degradation of these proteins in the egg is actually happening. So I guess with that, I guess I'll finish this and then we'll move on to the next presentation by Jackie, and we'll take questions that you might have at the end. But thank you.
Just a reminder, if you did have questions, that you could post them in the chat. To find how to do chat, you go to the bottom middle of the screen, and there's a chat function, and you can enter your questions there. So we didn't get much yet, so certainly be sure to do that. As you see, the next speaker is getting your presentation up. Our second speaker, Jackie McCarville, will present Keeping the Calf Kitchen Clean, a look at cleanliness and sanitation. Jackie is the agriculture educator for Extension in Greene County and also helps with her husband's family dairy farm. Jackie has her bachelor's degree in animal science with a dairy emphasis from UW-Platteville. Jackie's interests are in nutrition and pre-wean calves. So with that, Jackie, are you ready to go?
I sure am. So thanks, Matt, and both Matts. As Matt Eakins did say, keeping these calves clean is a critical thing, and I'm sure we've all seen the articles talking about how much it costs to raise a heifer from birth to getting them in the milking herd and the long-term effects of having sick calves. So we're gonna just go over some things that you guys can do to help those calves who are 2 months and under, so they can become profitable for us in the long run. So what does cleanliness mean? Cleanliness is the quality, state, or habit of being clean. It is also important for physical well-being and a healthy environment. Cleanliness isn't just about making sure the calf has dry bedding. It involves housing, cleaning and sanitation, and what tools are there available to help us get these jobs done. Let's start with bedding. Pre-weaned calves spend more than half of their time lying down, and neonatal calves spend over 3/4 of their time lying down. Regardless of the season, bedding is important to create a comfortable, cushioned surface for lying. Bedding should be clean, dry, and low dust. Options will depend upon the availability, but include straw, wood shavings or sawdust, almond hulls, or a combination. Clean, dry bedding is also important for calf hygiene. Clean bedding can reduce the chance of pathogens entering the not yet healed navels of neonatal calves. To prevent the navel from touching the bare ground, bedding should be laid before the calf is placed in the pen or hutch. Initially, approximately 20 to 25 pounds of bedding at a depth of 12 inches should be provided for each calf. Bedding also provides a barrier between calf and the fluids, such as the milk or spilled water. A moist environment can harbor pathogens, and it is always important to have proper drainage below any type of bedding. One of the issues with wet bedding is the loss of body heat in young calves. If calves are losing their body heat, they're using calories needed for growth just to keep warm. Calves consume a lot of liquid between milk and water, and around 80% of the liquids they consume is excreted as urine. And as the calf gets older and eats more dry grain, we end up with less water excreted as urine and more excreted as feces. So do you know how dry your bedding is in your calf hutches or pens? A simple test that can be done is to kneel on the bedded surface and rock back and forth on one knee. If you get up and your knees are wet, you will know that the bedding isn't dry. And this is a great way for testing to make sure that not just the top of your bedding is dry, but that it's dry all the way down to the bottom of the surface. A proper ventilation moves air and provides fresh air to remove organisms from the environment. It helps lessen the dust and remove harmful odors. It removes extra moisture in the winter and heat in the summer. It also provides a clean environment for animals and people and allows buildings to last longer. Poor ventilation can cause a buildup of compounds that may impair a calf's immune response, cause respiratory problems, make the calf more prone to pathogens, and reduce feed intake and conversion rates. An anemometer is used to measure the airspeed and is a great way to make sure you are hitting the target rates at the different temperatures. Next, we'll talk about the ideal calf pen. So the ideal calf pen concept is a pen design concept to promote biosecurity between calves while maintaining good airflow within the microenvironment of the pen. The key concepts of the Wisconsin calf pen are to provide 32 square feet of resting space for the calf, with enough bedding to wick away moisture, provide cushion to minimize physical trauma. Research shows that young calves spend over 50% of their time during the day laying down and 100% of the time during the night. So we need to make sure that our pens are big enough to allow for them to lay down. Solid panels between calves are used to minimize respiratory disease by blocking drafts and limit disease transfer from one calf to another. The pen walls should be 4 feet tall to minimize drafts and limit nose-to-nose contact. The side panels should extend 12 inches past the front of the pen to minimize nose-to-nose contact from one calf to another when their heads are out and they are eating or drinking. While the side panels are solid, each pen should have an open front and rear panel to promote good air quality and ventilation with the individual calf pen. When the pen is enclosed by 3 or more sides with solid panels, the calf's laying space can become a microenvironment where fresh air does not reach into the pen, increasing the risk of respiratory disease. Each pen should have a maximum 18 inches solid panel in the back of the pen to maintain bedding. And the front of the pen should have two holes, one each for access to feed and water or milk pails. Having 2 holes instead of 1 minimizes the amount of feed and water a calf will dribble from one pail to another when it's eating or drinking. This helps reduce the contamination of feed and water. So my first poll question to you is, what procedures do you utilize when cleaning calf bottles and buckets? Do you rinse with water? Do you wash with soap and water and rinse with water? Or do you rinse, scrub with detergent, apply a disinfectant, or are you doing something else? So give you a little bit to fill that out. Just a couple more seconds if anybody else wants to answer, otherwise we'll end the poll. And it looks like about 50% are washing with soap and rinsing with water. 39% are rinsing, scrubbing with detergent, and applying a disinfectant. And 11% are rinsing with water. So why is it important to talk about cleaning? Biofilms are defined as a microbial growth on a solid surface. Bacteria, viruses, and protozoa are microbes, as they cannot be seen without the help of a microscope. Many of the microbes which live in a biofilm can be potential disease concern for calves. In order for the organisms to live, they need nutrients in the form of carbohydrates and proteins. On the farm, we have a great source of protein to sustain these biofilm growth in the form of milk or milk replacer. Biofilms form for a variety of reasons, but the 2 main ones are improper cleaning to remove the milk or milk replacer residue and imperfections in feeding equipment. So when we talk about cleaning, cleaning something by using the correct temperature. Scrubbing and drying isn't all that matters. We also need to make sure we are using a detergent, disinfectant, and a sanitizer. Different chemicals have different purposes. We must know which is the right one to use for each case. Detergents are used to break up organic deposits, such as fat and proteins. Disinfectants are used to kill microorganisms. And finally, sanitizers are used to reduce the number of microorganisms, but it does not kill them completely. This improves hygiene, but is not a substitute for a good cleaning practice. A good cleaning practice is important. The removal of milk or milk replacer residue in feeding pails, bottles, nipples, and other feeding equipment is important. Don Sockett, from the Wisconsin Veterinary Diagnostic Laboratory, recommends the following cleaning protocol for your feeding equipment. First, start with rinsing the feeding equipment using 90-degree Fahrenheit water. Next, soak it in hot water greater than 130 degrees Fahrenheit with a 1% chlorinated alkaline detergent. Wash water should be greater than 145 degrees, and it is recommended to use a soft bristle brush while cleaning the equipment to help eliminate any other residue that may be on the surface. Avoid using a hard bristle brush as it may cause scratches on the surface of the pail or equipment you are washing, which in turn will provide a place for residues to harbor. Then rinse the equipment using a cold water solution that contains 50 parts per million of chlorine dioxide. Dry the equipment by letting it drain and dry completely before reuse to prevent the growth of bacteria. Place the pails upside down on a drying rack instead of stacking them inside each other to allow both the inside and the outside of the pail to dry completely. Final preparation of the equipment should include spraying the inside and outside of the calf equipment with a 50 parts per million chlorine dioxide solution 2 hours or less before the next use. So what should we clean? All feeding and watering equipment should be kept clean. This includes the milk bottles, the nipples, milk buckets, waterers, starter buckets, feed troughs, and mixing equipment. Milk supplies should be cleaned after each feeding. Water should be cleaned weekly when visibly dirty or more frequently during a disease outbreak. Keep in mind, plastic or rubber feeding equipment can develop scratches which harbor microbes, and these supplies will need to be replaced more frequently than those made of stainless steel. Most providers who have purchased stainless steel feeding supplies have indicated the switch was worth the investment. Scrub brushes used to clean feeding supplies should be separate from those used to clean calf housing and other equipment. Also, make sure you have plenty of proper lighting in the cleaning area to ensure that the equipment is being cleaned properly. Getting into a good cleaning routine is critical. Having a schedule on your farm can help you or your employees know how often things should be cleaned. But just posting a cleaning schedule isn't enough if you don't follow through and do the actual cleaning. Some key points to remember about cleanliness and sanitation is that sanitation is critical in breaking the disease cycle. Make sure you are using the right disinfectant. Does it work against certain pathogens or is it broad spectrum? Cleanliness equals healthy calves, which equals productive cows in the dairy herd. And remember, we're trying to do everything possible to keep these animals in our herd. So not all disinfectants work for everything. You need to know which product to use for which problem you have. And this slide might seem a little busy, but we will break it down a little more. First, we will start with the disinfectants that have no activity. When we look at coccidia, it doesn't have any options for disinfectant choices. Limited activity disinfectants are next. Fungal and coronaviruses have limited activity choices. Effective disinfectant options is next. Acids, halogens, and oxidizing agents seem to have more options that work for them. And finally is our highly effective disinfectants. Mycoplasma seem to have more options of highly effective disinfectants. So how do you know how clean your feeding equipment is? Many farms are using a luminometer or an ATP meter to check on cleanliness. It is a small handheld machine that allows the user to identify areas that are dirty and contaminated with potentially harmful infectious agents. A swab of the equipment or area is taken and then inserted into the ATP meter, which reads the amount of light produced by the sample within 15 seconds. The amount of light emitted is measured as relative light units. The light produced is proportional to the amount of ATP in it. So the more bacteria or product residue on the surface, the more ATP, which therefore means the more ATP, the more light is produced. And with more and more dairies using ATP meters to check how clean everything is, Dr. Sockett came up with some guidelines that he presented in 2019. These guidelines will change with the more usage of ATP meters on farms. Another way to look at it is to swab the sample area before using. Record that number. Use the equipment and clean like you would normally do. Swab the equipment again after cleaning and waiting 20 to 30 minutes, and the number should not be higher than the beginning sample. We want to see a reduction in the amount of relative light units. We also must think about the safety of our employees with using chemicals. There are some safety precautions that should be followed. Always use proper storage of the chemical. Workers should wear gloves, masks, and eye protection when working with the chemicals. Make sure you are in a well-ventilated area when mixing and using chemicals. And finally, follow all label directions. Some other factors to consider when talking cleanliness and sanitation is overall animal health. Was it born healthy? Does it have any other issues? How clean is the animal? Are the pens the animals are housed in after weaning kept at the same standards as pre-weaning? Are those who are feeding calves wearing clean clothes? Are they working on multiple farms and potentially spreading diseases from one location to another? So following proper bedding, ventilation, and pen setups can help get the calf off to the best start possible. Following up with good cleaning and sanitation protocols will take your calf health to the next step. The final step is utilizing the tools created to take your kitchen to the next step. And with that, that is my contact information.
Say you folks have been leaving us off pretty easy. We don't have much for questions. Just a reminder, if you did have a question for either Matt or Jackie, that you can put them in the chat. And we have a couple links in the chat. One is for an evaluation today. And another one is if you want to participate in future programs for this the Badger Dairy Insights, that you can register for these or other extension programs on that website that's posted. So otherwise, I'm waiting for more questions, but otherwise I will go through just a few closing comments. I already covered the one about evaluations. Future programs. So next week, the same time, January 26th, emerging productive strategies using IVF embryo transfer. The week after that, February 2nd, animal care on the farm and beyond. And then on February 9th, preventing injuries when working with cattle. And then again, just a reminder of those links. Otherwise, we still have a little more time here, but if there's no other questions or comments,